Terrebonne Parish has lifted their mandatory evacuation because power is being restored, with many in the parish and businesses are reopening. Now, this includes their hospitals, which were hit hard by Ida and forced them to evacuate. As Mike McDaniel shows us, Terrebonne General Health System is doing whatever they can to meet the needs of the community.
Here at Terrebonne General Health System, the emergency department is unable to operate, so the hospital moved it out here in a parking lot. 3 tents operating under limited hours, trying to meet the healthcare needs of this community. As Hurricane Ida barreled down on Houma, parts of Terrebonne General Health System peeled away.
It just blew up the roof on the top, and then it started coming through the windows of the patient rooms.
We could see doors rumbling.
The hospital lost power and water.
Windows breaking.
And with it, the ability to care for the 120 patients still inside.
Glass, shattering in our patient areas.
30 of them critical care.
It was nerve-wracking for sure.
Dr. Andrea Lorio was caring for those patients during the storm.
We had to move patients away from the windows, so we were moving them to central areas in the rooms, and in some cases out into the hallways to get away from shattered glass.
Once the damage was done, hospital leaders had to make a quick decision.
We realized at that point we had to evacuate.
All 120 patients, many of them COVID patients, were sent to hospitals across the state, even into Mississippi.
It took a full 24 hours.
Unable to provide any health care, hospital CEO Phyllis worked with staff to get medical services reestablished.
With a community this size and people coming back to look at the damage, you have to offer something.
Within a week, this parking lot emergency department was seeing patients, up to 90 a day, and growing. The hospital got power back Friday, but because of the damage, inpatient care isn't possible yet.
We do have a MASH tent, a field hospital, to help supplement those individuals. So we really are able to handle a lot, and if it's more than that, we have Acadian ambulance or ambulance services on standby to transfer them out to an alternate facility.
A lifeline, too important to flatline in a time of need. In Terrebonne Parish, Mike McDaniel, Eyewitness News.
Well, outpatient labs and cancer services are back operating at Terrebonne General. They hope to reopen hospital clinics this week and bring back all medical service within the next 30 days. Shabir Medical Center, the parish's other main hospital, is back operating. The emergency department and primary care clinic are open too. They expect about a month before the hospital is running completely.